Good morning. This is Dr. Tarek. Today I am discussing medical terminology about respiratory system, and I start with different words. First two words are nase and rhine. Both mean nose. Nase, from nase you can make nasal drops, nasal septum, and for rhine the words are rhinorrhea, rapid fluid flow from the nose, rhinorrhagia, blood flow from the nose. Next is pharynge and pharynx. Pharynx is word root, which is Greek or Italian, and pharynx is English. We always make medical terminology from the word root, never from the English word. So from pharynge, we will make pharyngitis or pharyngoplegia. Plegia. Pharyngitis means infection of the pharynx, and pharyngoplegia means paralysis of the muscle of the thorax. This can happen during the paralysis. Larynge and larynx. Larynge is word root and larynx is English word that mean voice box. Laryngitis, laryngectomy, laryngoplegia. Laryngoplegia mean paralysis of the voice box. Laryngitis mean infection of the voice box. And laryngoplasty mean plastic surgery for plastic repair of the larynx. Next word is bronch and bronchi. These are two word roots mean bronchus. Bronchus is a passage, respiratory passage which going to each lung, right bronchus and left bronchus. We have it one trachea, which has two branches, right bronchus and left bronchus. If infection occurs here, it is known as bronchitis, and smoker's pneumonia is a very common name which happens in smokers. Next word root is trachea. The trachea and O is vowel, tracheo. It means trachea. Trachea means windpipe, which is present in our throat, continuing with the larynx. From tracheo, we make the word tracheostomy. Stoming means making a surgical opening. So we make surgical opening in the trachea. Maybe there is some tumor not allowing the food to pass through, or maybe difficulty in breathing. So relieve these problems, we make tracheostomy, surgical puncture in the trachea. Tracheotomy, just cutting the trachea. In case of emergency, the chances of suffocation, something stuck in the throat, we can make tracheotomy, cutting into the throat, into the trachea. Then there are three word roots which mean oxygen. One is oxy, OXY, number two is OXI, oxy, and number three is OXO, oxygen. And from here we make the word hypoxia and hypoxemia. When we say hypoxia, it means deficiency of blood at the cellular level or at the tissue level. Hypo means less, X means oxygen, E means condition. So this is a condition of less oxygen at the cellular level or at the tissue level. Hypoxemia, this is less oxygen in the blood. Emia is blood condition, X is oxygen and hypo is less. So condition of less oxygen in the blood. Hypoxemia in the blood, hypoxia in the cell or in the tissue. The next word root is nia. Nia means breathing. Then the words we make are Apnea means no breathing. Dyspnea means difficulty in breathing, short of breathness. This is also known as short of breathing. Eupnea, U means normal. Eupnea means normal breathing. Hyperpnea means deep and fast respiration. Deep and fast respiration. Hyperpnea. Our normal breathing is between 10 to 20 per minute. If it is more than 20 per minute, we call it tachypnea. And if it is less than 10 per minute, we call it bradypnea. It is more than 20, we call it tachypnea. If less than 20 per minute, we call it bradypnea. Next word is neem. Neem and pneumon. Both mean lung as well as air. Pneumonectomy. Surgical removal of the lung. Maybe a part of it or maybe the whole lung. Pneumonectomy. Pneumonia. Pneumonia means infection of the lung. Pleuro. It is a word root for pleura. Pleura is a membrane that covers the lung. So pleuro means pleura. Pleuritis. Infection of the pleura. In pleuritis, if the patient take a deep breathing, it is painful. That is the sign of pleuritis. Take a deep breathing, patient will feel pain. Pleurectomy, surgical removal of the pleura. This is a membrane that covers the lung. It is a two-layered membrane. Visceral layer covers the lung and parietal layer covers the inner side of the chest. And there is space in between. This is known as pleural space. This space contains some fluid which is known as pleural fluid. This fluid protects the lungs while we are breathing again and again. It may touch these ribs and get injured, but this fluid protects it. Keep it moist. The next word is thorax. Thorax is Greek or Italian word. In English, we call it thorax or chest. I told you the medical terminology, medical words are always made from the word root, never from the English meaning. Thoracotomy. Thoracotomy means cutting into the chest. We enter into the chest. And hydrothorax. Hydro means water. Water comes in the thorax sometime. That condition is known as hydrothorax. Or blood may come into the thorax, which is known as hemothorax. This happens in roadside accidents, stab wound injury or bullet injury. There can be blood, there can be water in the chest. Hemothorax, hydrothorax. The third condition is pneumothorax. There can be air. Pneum means air, thorax is chest. So pneumothorax means air in the chest. And next word is hemopneumothorax. So hemo means blood, pneum means air. Hemopneumothorax means blood and air both are present in the chest. Centesis. This word root centesis means making a surgical puncture to aspirate the fluid from cavities of the body. It can be anywhere. So making a surgical opening to aspirate the fluid. Centesis. If we are doing this procedure on the chest, this is known as thoracocentesis. Thoracocentesis. And if we are removing fluid from the abdominal cavity, this is known as abdominocentesis. Thoracocentesis or abdominocentesis. Then next two words are phlegm and sputum. There is confusion about these two things. Let me clear. This is the same secretion which is secreted by the mucous membrane of the lungs. When it is inside the lung, it is known as phlegm. And when we cough it out, it is known as sputum. It is same thing. When according to the location, its name changes. When inside the lung, its name is phlegm. When outside the body, we cough it out, its name is sputum. Next word is spiro. Spire means breathing. Spirometer, that is the machine to measure our breathing. And when we are doing this test, this is known as spirometry. From here we know the amounts, how much air is gone inside in inspiration, how much air has been breathed out during expiration, and how much air remain inside. That is known as residual volume. So all these volumes are calculated by this machine. Spirometer, machine to calculate the breathing. Next word root is pyo. Py/O. O is vowel. Pyo means pus. The word can be pyothorax. Pyothorax, pus in the chest. It is also known as empyema chest. Empyema chest. Because it is not treatable by antibiotics, so we have to aspirate this pus from the chest and then put the patient on antibiotics to stop the further formation of pus. Pyothorax. Another small machine is oximeter or oximetry. Oximeter is a small machine that is attached with the finger of the patient or even of the healthy person to check the oxygen level in the blood. It should be 98 to 100% normally. Oximeter, and when we are checking this oxygen level, this is known as oximetry. This is known as oximetry. This is all by this time. Thank you very much.